you see a person at any age, at any stage of baldness, he will never lose hair from this side. They are DHT resistant. DHT cannot react on them. So when you are going to remove the follicles from this zone and implant in the affected areas, they will not go off from there as well. So if done with proper protocol under an experienced surgeon, the pain level I could say is as well as much as 0.
Hello everyone, welcome back to the new episode. In this episode, we are going to discuss about the hair transplant. Let's hear it from the expert, Dr. Moniz.
Sure. So Jeet, as we had discussed that hair transplants means in a very simple layman's language that you're going to remove your hair, the follicles from the back area, and they are implanted in the desired or the affected site. But why from this zone? Because these hair fall in a permanent zone. So by permanent zone, mera matlab hai dihydrotestosterone, the DHT hormone, which is the main cause of hair fall. These hair are resistant to DHT. So what I want to say here is, that you see a person at any age, at any stage of baldness, he will never lose hair from this side. They are DHT resistant. DHT cannot react on them. So when you are going to remove the follicles from this zone and implant in the affected areas, they will not go off from there as well. So this is how we simply define a hair transplant procedure. Okay. Now, when we talk about the techniques, so how it is done, which is by perhaps the most important factor here. So the techniques have evolved from a long time now. In fact, you'll be surprised to know that the first hair transplant was done as long as 70 years back in 1954. There was a doctor in US who did his first hair transplant, and gradually with time things improved. The new technology came into existence. We all know the two major techniques here, the FUT and FUE method of hair transplant. Right. FUT came into practice early on, maybe as early as early 1990s, where in FUT what we do is we are going to remove a strip of skin from this donor. So you're not going to remove the follicles here, you're going to remove the entire skin from the donor, and then the grafts are dissected, segregated, and you implant there. So this was a strip technique, or we even call it as an FUT technique of hair transplant.
Okay, so that's a proper surgery.
That's a proper surgery, yes. Then came FUE. So this was early 2000s when the surgeons, with a lot of trials, they came to that instead of removing an entire strip of skin, why not we go ahead and remove the individual follicles from the back? So FUE stands for follicular unit extraction. All right. So where you're going to extract those follicular units from the donor and then they are implanted.
Yes.
So by follicular units also, I need to clear this because there are many times patients, they get confused कि doctor what graft क्या होता है, hair क्या होते हैं, follicular units क्या होते हैं, follicles क्या होते हैं. So एक चीज होती है, follicular unit is something we can call it as a group of hair. So your hair, they are never coming one by one. It is never like a single root, a single hair. So hair, they come in groups, bunch. There might be 1, 2, 3 or even 4 hair with same number of roots coming together. So that bunch is known as a follicle, a follicular unit. So that entire follicular unit, or we even call it as a graft. So the graft is extracted and implanted in the recipient areas. So the method of extraction here is how the name of the technique came into existence, that when you're removing with the strip, it was a follicular unit transplant or a strip method. And in FUE, it is individual follicles are extracted. The way you implant them, so this was how you have extracted. The way you're going to implant in the recipient zones, again, so maximum number of doctors, surgeons still now are performing something we call it as a slit method, whereby you are going to create small holes or slits in the desired area, and then those grafts are implanted, be it FUT, be it FUE. Right. The method of implant remains the same. You are going to create those holes in that areas, and then the individual grafts are going to be implanted in those zones.
Okay, so the space is created in the tissue and then the root is placed.
Yeah, you create those slits. You can call it as a hole, you can call it as a slit. You have made them, and then the entire graft is implanted inside that. Okay. But the only drawback that I have considered in this while practicing this technique was the direction part and how you're going to control the density here. So then there came evolution of people have started using implanters. They call it as direct hair transplant method, which I'm sure we're going to discuss in detail later on.
Yeah.
But broadly, in a very simple sense, if I'm going to describe you, this is how those two techniques, FUT and FUE, were practiced and still are being practiced.
Okay, so what is the pain factor? How much is the pain in this sort of procedure? Patient has this doubt in their mind. Is it painful, right? So can you just put a light on it?
Okay, so be it FUT or be it FUE, the procedure is done under local anesthesia. So by local anesthesia, again, I would like to say that you are not going to anesthetize entire body or entire head of the patient. It is those localized zones, particular only the area where you're going to treat, that is anesthetized. So if done with proper protocol under an experienced surgeon, the pain level I could say is as well as much as zero in that. I have seen patients, they are reading books, they listen to songs, they drive back home in fact after treatment. So there is no pain factor here. But again, it all depends on how you're going to be treated, who is going to treat you, and the experience matters a lot. But if done in a proper way, the pain factor in any of the technique is zero.
All right. So in this episode, we have discussed about how the root is extracted from the back. There are two techniques. One is FUT, one is FUE. FUT is a surgical procedure where the skin has been removed and then it has to stitched back, right? So it is considered as a surgery. Now, the other technique which we discussed, that is FUE, where one by one the root is extracted from the skin without making any cuts in the skin. So there is a small like rotomotor device which has a punch which just goes around the hair and starts plucking it out. Okay, and we have an animated video explaining the same on our channel. Now in implantation, doctor has explained the slit method. You can search all over the internet what is slit method. In that they make holes and then put roots inside the hole. Now the hole is always bigger because the root has to be placed. Now because of the diameter of the hole, the density, usually you cannot achieve a very high density. That's one challenge. And as doctor told us, there is a issue with the angulation also. I hope this information has been helpful to you. If you need any more clarity from our side, you have any questions, any concerns, you can always ask us in the comment section. We will reply you as soon as possible. You can also book an appointment for the free consultation in our clinics where we can evaluate your scalp and we can tell you the treatment required for you. And we will keep giving you more insights about the transplant. We will be back in our next episode. Thank you very much. Stay tuned.